Well, they're probably confused because they've not read it. But the reality is that I have been spending time in this campaign listening to American families, listening to experts, listening to healthcare providers. And what I came away with is a very clear understanding that I needed to create a plan that was responsive to the needs of the American people, responsive to their needs, understanding that insurance companies have been jacking up the prices for far too long, that American families have to be held down by deductibles and co-pays and premiums that can cause them bankruptcy. I listened to the American families who said 4 years is just not enough to transition into this new plan, so I devised a plan where it's going to be 10 years of a transition. I listened to American families who said, I want an option that will be under your Medicare system that allows a private plan. So I designed a plan where, yes, responsive to the needs of American families, there will be a public plan under my plan for Medicare and a private plan under my plan for Medicare. Because the bottom line is this: we must agree that access to health care must be a right and not just a privilege of those who can afford it. And in America today, far too many people, in fact, 30 million people, are going without access to health care.
Thank you, Senator Harris. Vice President Biden, your response.
Well, my response is that the senators had several plans so far. And anytime someone tells you you're going to get something good in 10 years, you should wonder why it takes 10 years. If you notice, there's no talk about the fact that the plan in 10 years will cost $3 trillion. You will lose your employer-based insurance. And in fact, you know, this is the single most important issue facing the public. And to be very blunt and to be very straightforward, you can't beat President Trump with double talk on this plan.
Your response, Senator Harris?
Absolutely. Unfortunately, Vice President Biden, you're just simply inaccurate in what you're describing. The reality is that our plan will bring health care to all Americans under a Medicare for All system. Our plan will allow people to start signing up on the first day. Babies will be born into our plan, and right now 4 million babies almost are born every day in America, or every year in America. Under our plan, we will ensure that everyone has access to health care. Your plan, by contrast, leaves out almost 10 million Americans. So I think that you should really think about what you're saying, but be reflective and understand that the people of America want access to health care and do not want cost to be their barrier to getting it.
Senator Harris, thank you. Vice President Biden, your response?
The plan, no matter how you cut it, costs $3 trillion when it is in fact employed. Number one, 10 years from now, after 2 terms of the senator being president, after her time. Secondly, it will require middle-class taxes to go up, not down. Thirdly, it will eliminate employer-based insurance. And fourthly, what happens in the meantime?
I'd like to respond. First of all, the cost of doing nothing is far too expensive. Second, we are now paying $3 trillion a year for health care in America. Over the next 10 years, it's probably going to be $6 trillion. We must act. My plan is about immediately allowing people to sign up and get into coverage. Right now in America, we have seniors who every day, millions of seniors, are going into the Medicare system. And they are getting full coverage and the kind of coverage they need. All people should have access to health care, and cost should not be their barrier.
Thank you, Senator Harris.